My name is Ralanda Hall, and I am from Saskatoon, Saskatchewan. So, I was initially diagnosed back in December of 2018. My diagnosis probably should have happened sooner, but due to anxiety and depression, I had avoided a doctor for a few years. And so when I finally did go in to see my primary care physician, I had just mentioned casually that I had a bit of a lump in my abdomen that she probably would want to send me for an ultrasound. And that day, as she was examining me, it was all she could do to finish most of the exam once I was laying on the table and she could see the visible lump. So from that point, um, she had called in another physician from the office to come in and check it out. There was thoughts of sending me by ambulance to the nearest hospital, thinking that it might have been an aortic aneurysm. Um, but knowing my history of depression and anxiety, and we had just got that under control, my doctor did what she needed to do to keep me in the office that day. Being as it was December of 2018 here in Saskatchewan, we had actually lost most of our gynae oncologists for the province. They were overworked, and some of them left for medical reasons, and some of them left to go to other provinces where they weren't um, as overworked. And so during that time, they were bringing in locum doctors. So locum is just they're covering and bringing them in to help out, right? So my family doctor had actually phoned one of the locum doctors out in Ontario and said, "I know we're not really taking any patients right now, but I have an urgent need. My patient really needs to see someone. Can we get you scheduled in?" And so, from the time that I saw my doctor on November 16th to the date of my actual surgery was less than a month. From that point on, when the surgery was done and over with, the surgeon had come out and said, yes, it is in fact cancer. It is ovarian cancer. We don't know what type until the pathology reports come back. And I only ever saw him once. I saw him the day of my surgery and then like the day after, but I didn't see him again throughout the rest of the process. So the day that I received my diagnosis in the actual cancer clinic, it was a brand new face. I had never seen the doctor or the resident before, and you're receiving a diagnosis from somebody you've never met before. It was really hard to find that connection with your doctor. We all know that when we go to our family doctor, they will walk in and they will ask you, like, how are you doing? How's your family doing? I didn't get that because I was seeing someone new every single appointment that I had. So when I was going through treatment, I was able to discuss my anxiety and depression with my oncology team. And they have been really helpful in connecting me with social workers, but also letting me know of different programs that I can go into or connect with. And there were a couple of times in my last recurrence where I was able to actually phone my oncology nurse and say, "Hey, some of these medications are giving me dangerous and suicidal thoughts." And what was really fantastic is within the day, I had a phone call from my oncologist asking me how I was doing, when I took the medication, what thoughts I was having, and we immediately knew to stop one medication. It's still nice to be able to connect on that level where you can phone and say things aren't going well, and they'll sit down and listen to you, whether it's a phone call or in person, to have that connection and understanding. Ever since my diagnosis, and actually even dealing with depression and anxiety after having my son, um, I find that sharing my story If it helps even just one more woman, then I have made a difference. I want to be more involved in the process of everything because I don't want the statistics to remain the same as they've been for the last 50 or 60 years. We deserve better. And the only way that we are going to get better with funding and research and everything like that is by raising our voice and talking about it and letting others know that this is unacceptable. We deserve to live just as much as everybody else, and let's talk about this. Let's get things going and let's find a cure. And not even just a cure at the beginning. Let's find a test that actually works and detects ovarian cancer before it gets to stage 3, stage 4.